Hello everyone, this is Dr. Shweta Anand and welcome back to my channel Simplified Dentistry. In today's video, let's know about dry socket. So dry socket is a post-operative complication that occurs after a dental extraction. Its incidence after a routine tooth extraction is rare but is quite frequent after the removal of impacted mandibular third molars. It is defined as the postoperative pain in and around the dental alveolus, that is, the tooth socket, which increases in severity at some moment between the first and third day after a dental extraction, accompanied by partial or total disintegration of the intra-alveolar clot, accompanied with the foul smell. So basically what happens is that the blood clot that should form after tooth removal is dislodged or dissolved before the wound heals, exposing underlying bone and nerves. Normally, a blood clot forms at the site of a tooth extraction. This blood clot serves as a protective layer over the underlying bone and nerve endings in the empty tooth socket. The clot also provides the foundation for the growth of new bone and for the development of soft tissues over the clot. So the exposure of the underlying bone and nerves result in intense pain not only in the socket but also along the nerve radiating to the side of your face. The socket becomes inflamed and may fill with food debris, adding to the pain. Now let's have a look on the symptoms. So the pain typically appears on the second or third day after extraction. However, dry socket can occur at any time during the healing process. There will be the absence of normal healthy post-extraction blood clot in the socket, which you may notice as an empty looking, that is dry socket. So instead of a dark blood clot, there will just be whitish bone. You may experience pain that radiates from the socket to your ear, eye, temple, or neck on the same side of your face as the extraction. So in the case of dry socket, over time pain becomes more severe. You may also feel pain when you drink something cold or breathe in cold air. You can also experience bad breath or foul odor or unpleasant taste in your mouth. Now let's have a look on the possible causes which can lead to dry socket. It may occur due to bacterial contamination of the socket. According to Nidzin's theory, the organism that is responsible for dry socket is Treponema denticola. Trauma at the surgical site from a difficult extraction, as with an impacted wisdom tooth, can also lead to dry socket. Poor oral hygiene can lead to bacterial contamination, which in turn can cause dry socket. Smoking or chewing tobacco can also cause dry socket. Taking oral contraceptives or birth control pills can also cause dry socket. Research shows that women are slightly more likely than men to develop dry socket. This is probably due to estrogen, as the hormone may dissolve blood clots. Another cause is having a history of dry socket after tooth extraction. So, basically if you had dry socket before, you may be more likely to experience it again. Another cause can be rinsing and spitting a lot or drinking through a straw after having a tooth extraction. So basically, anything that dislodges the blood clot from your extraction site can increase your risk for dry socket. Now let's have a look on the treatment of dry socket. So if a dry socket occurs, the aim of treatment should be relief of pain and the speedy recovery. The socket should be irrigated with normal saline and all degenerating blood clots should be removed. Sharp bony spurs should also be removed. And a loose dressing composed of zinc oxide and oil of cloves on cotton wool is tucked into the socket. Analgesic tablets and hot saline mouth bath are prescribed and arrangements are made to see the patient in 3 days' time. Now let's have a look on the preventive measures that can help you to prevent the formation of dry socket. People should take care not to rinse their mouth too vigorously. Rinsing the mouth is possible after a tooth extraction, but it is important to do it gently to avoid disturbing the blood clot. Do not spit or use a straw for 24 hours following a tooth extraction. Avoid chewing on the side of the mouth where the extraction took place to minimize the chance of dislodging the blood clot. Do not smoke for at least 24 hours, ideally 48 hours after an extraction, as smoking delays healing and also increases blood pressure, which can lead to more bleeding. Also, don't use tobacco for at least 48 hours after surgery or as long as you can after that. Any use of tobacco products after oral surgery can delay healing and increase the risk of complications. A person should avoid alcoholic beverages for at least 24 hours to reduce the chance of the clot becoming dislodged. Alcohol can also encourage extra bleeding and delay the healing. Choose soft foods rather than hard or crunchy foods, as this can reduce the risk of damaging the socket and getting food stuck in it. Refrain from drinking carbonated or hot drinks, as both of this could cause displacement of the blood clot from the socket. For female patients on oral contraceptives, extraction should be performed during days 23 through 28 of tablet cycle, that is the day when you are getting the lowest dose of estrogen, as this hormone can affect the ability of the blood to clot. Also, you should check with your dentist about other medications you are taking that can interfere with normal blood clotting. People should limit strenuous activity for first 24 hours after the extraction to reduce bleeding and help the clot formation. So that was it for today. Thank you for watching the video. If you like the video, then please like, share and comment down below. And if you want more such contents, then please subscribe to the channel Simplified Dentistry.